Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who treats knee pain often, and something I've said for a very long time, that very common interventions like anti-inflammatory drugs and steroid injections have the potential to make your joint worse. In no scenario do they actually make things better in the long run. Before I go into the results of this particular study, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. That being said, this was a study looking at average age was 64, so we're not looking at a young spring chicken group, and they were given either hyaluronic acid, some people call it gel, Synvisc, or they were given steroids, and the imaging was taken 2 years before, or they had data for 2 years before, they had the day of the injection, and they had 2 years in the future. And they looked at, there's a scoring system that's pretty well accepted for the knees that looks at aspects of degeneration, like the meniscus, the bone marrow around there, the cartilage, all of that stuff. And what they found was that those people who did the cortisone were worse off than the people who had the placebo, the people where nothing were done for. Like, the changes were not very dramatic. However, this is just 2 years. How many... Jeez, oh Pete, the amount of people that get steroid injections is just... I don't know that I've had a patient that has come in that has not had one or multiple, whether it's the shoulder or the knee or whatever. And these things, there's every degree of evidence to suggest that they're cumulative. So each time has a tendency to make things worse in the long run. And if you get a shoulder injection, these things are systemic. So it's going to have an effect everywhere. So you can anticipate that shoulder injection might create a problem with the knee down the line. It's just the nature of how things work in the human body. And I'm very convinced that anti-inflammatories like ibuprofen, indomethacin, meloxicam, all of those have the same type of damage done to the joint health itself. I've been saying this for a long time. Me personally have not taken anything like that in probably 30 years, if not a little bit longer. So what can we do if we're having some knee problems? First of all, we need to be doing strength training. Our knee needs to be stronger. We need to be using it. All too often when somebody injures it, we go the opposite direction. We stop using it. We're afraid we're going to make it worse. There's very few scenarios where we're going to make things worse. We certainly have to let pain be our guide, and looking at things like eccentric strengthening. So if you're doing like knee extensions or quadriceps exercises, it's just as important on the lift part as it is on the reverse part. So that's very important. I see a lot of people trying to push as hard as they can, and maybe they drop it down. Or on the flip side, they are using too light of weight. They're not actually challenging their knee. They're not building strength. Aerobic standpoint as well. Generally, I'm a much bigger fan of short bursts, more high intensity. However, walking has been shown that people who walk more are less likely to have knee replacements. So, and then obviously an anti-inflammatory diet, maintaining an ideal body weight, and I have a clear bias because our office works very heavily on the soft tissues around the knee. Can't tell you how many times I've had patients coming in with a meniscal injury and they're panicked and they're worried that things are going to, and then literally after a single visit they're feeling dramatically better and more hopeful and they're starting to move again. So steroids are, in the short term, you're talking about short-term relief in exchange for long-term damage. So there just doesn't seem to be a good equation for me, and you can add the anti-inflammatory over-the-counter or prescription drugs to that same equation. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.